Welcome to the Notorious DID. I am Solara. This is part 3 of Solara backstory. I am covering my backstory for you, so you have a better understanding of our lives and what took place between 1998 and roughly to 2014. So I had closed out when we were in the county jail. That we got out of, obviously, we got out of there, and from there we were lucky with the circumstances that we were given, and we did not at the time have anywhere to go. But during part of that, we were put to, we were given probation, and we were put to, put in a halfway house facility for a few months. As I stated, we did not have any relatives in Las Vegas, and our relatives were in South Carolina. So they transferred me to South Carolina, back to my grandmother's place. Somehow, some way, and I don't know why, but Kay was listed as the person that we were with. I don't know why or how that took place, like I said. But anyway, didn't really make that much of a difference. With the South Carolina system, it wasn't working out because I wasn't under anything that had to do with any drugs or anything like that. And they made it to where I had to have drug testing, so on and so forth. That I didn't care about. Like I said, I wasn't on drugs. I did not, none of my charges, nothing had anything to do with that. But they were causing problems for me. They would show up where I was working and make a scene and everything else. And I was like, this is not working. Las Vegas is not like that. It's not like that. So I ended up going back out to Las Vegas with Kay, because like I said, for some reason she was listed as stuff to do with me and another relative. And for a little bit of time, we did not have a place to live. We were living out of a vehicle for a little bit of time until, excuse me, the probation officer I had was a very, very nice woman, and sadly enough, I cannot even remember her name at all right now. But I still remember everything that she did. She set me up in a place to live, put the deposit, everything. I mean, she was very, very nice. Everything took place a lot better moving forward with that, and in Vegas, because like I said, South Carolina, no. And from there, I of course got employment, and eventually Kay got employment, and we were able to keep the place going. at that point, at the employment I had, I met my daughter's, well, my now daughter's father. We instantly interested, but as I had said in a prior video, as it moved along, I knew there was something lacking. There was a lot lacking, actually, as far as any kind of relationship or anything like that. I have a lack of an ability. Me, Solara, I have a lack of an ability to have a decent relationship. I just do. I usually end up being the sole support of the relationship and the money, mostly the money, because when I get to a certain point, I'm not even the support mentally for the relationship. I'm just done. But I will put up with certain things that are necessary. When my daughter was born, I didn't have a lot of money, of course, and neither did her father, and I knew something was wrong, and he took me to the hospital. He had a bicycle and a little back carrier thing where you could sit, and I was sitting in that, and I was taken to Sunrise Hospital, and it was it was a decent hospital, and they told me they couldn't find anything. Excuse me. I had Braxton Hicks contractions throughout the pregnancy, and I was a high risk because I had priorly had a couple of miscarriages, and I knew something was not right. So I get to the hospital, and like I said, they said they can't find anything wrong. I said, something is wrong. I am not leaving the hospital until you figure out what it is. So a little while after that, they come to me and they say that, yeah, something's wrong. Well, the embiotic fluid that was supposed to be around my daughter, which embiotic fluid is what maintains the baby and keeps them functional and okay within your system. The embiotic fluid was almost completely depleted. I was told then that I was going to have induced labor. If I'm being honest, I have no idea where her father went at that point. I don't recall him being there, but I was placed into the hospital. Some point during that, Kay and the other relative came over to the hospital, but it was late that evening that my daughter was already late. Let me say that. I didn't mention that. My daughter was already late to the tune of several weeks. And then they did the induced labor shot. The people, they do not warn you of how severe labor can be, the pain, they just don't warn you. I wasn't warned, let's put it that way. It was a lot of pain. And then I got a pain shot in my back. Well, this went on for, I think it was around 11 something that night, all the way until my daughter wasn't born until 9:30 the next morning, if that tells you anything. So I was in labor for quite a while. But I got the pain shot in my back. I remember as soon as I got the pain shot in my back, I was relieved, but I also I went to sleep. Then when I woke back up, I was back in pain, and for one reason or another, they thought it was a good idea to give me a second injection, a second spinal pain injection. This was a huge mistake. Upon doing that, when my daughter was ready and I was taken back to have her, I couldn't properly feel anything during the pushing. It was a rough birth. They, for some reason, did not decide to do any kind of C-section or anything like that, and it was still vaginal, and there was a lot of bleeding. My daughter wasn't coming out. My daughter was she'd come out a little bit and then she'd go right back in. It was like a vacuum, like zoop, zoop, zoop. And I couldn't properly feel the pushing. So, unbeknownst to me at the time, but they ended up using the forceps to pull her out and keep her out. And then she had to go into, she had a breathing problem when she came out. I'm guessing between not having enough antibiotic fluid and everything that was taking place with going in and out. And they had to monitor her for that first 12 hours. So I got to see her, I got to hold her, which you never forget that first time when you hold your child or see your child. And my daughter, she was so sassy, even this first time out. I'll never forget. She looked at me, and the first thing she did was she went, stuck her tongue out. She can't even do that now. She does. She can't do that now, but that was the first time she looked at me. She's just like, I was like, okay. Well, she's out. She's good. And then, like I say, they cleaned her up, and then they took her back for that monitoring. Well, after that, I was in surgery for an hour and a half, and I still couldn't feel anything properly. So I didn't feel any of the pain or anything like that at that time. But I do remember the doctor saying, I'm having problems stopping the bleeding. And he did say I may have to leave the sponge in. And I'm like, no, you're not. You don't leave sponges in people. Because he's like, to stop up the blood. And then I guess they also had to extract, I had some kind of growth in my stomach walls that they had to extract that was evidently the size of a grapefruit. So that was a big struggle. Then when that was over with, at some point, I will say at some point, so you understand the full realm. At some point during all of this, me giving birth and everything else, her father disappeared into the hallway to talk to another female. I am telling you right now, I should have known better. Should have known better. I did know better. But, so then I was in the hospital for a full week, and because I was unable to get up and stand until like the last day or two of that week. Then for a lot of time actually, after giving birth to my daughter, I could not even get out of bed. I could only get up barely to use the restroom and to take a shower, things like that. It was a hard process, and it was the beginnings of, I guess because I couldn't properly feel the pressure I was putting when I was giving birth, it is what caused the injury to my lumbar back, the pressure, and began the long road I have had with back problems, with having degenerative disc disease, advanced arthritis in my back. Today, it is at the point where I was told 3 years after my daughter was born in 2000, so I was told in 2003 that my back was the back of an 80-some-year-old, and within that time span, farther down as it kept going, I was told that it obviously it keeps getting worse and worse. I have no fluid in between my vertebrae, most of them at this point. So there's rubbing and deterioration with that. I have very little, there's a lot of deterioration with tailbone. The deterioration goes up into, all the way up into my neck, my cervical spine. So a lot of the problems I have are due to that. I did develop muscular skeletal disease as well from as this progressed, which is muscle problems with muscle spasms and muscles not reacting properly. With it being your spine, that causes everything to react throughout your entire body, mostly. Definitely your legs, because I also have nerve damage. As it's progressed, my nerve damage has gotten worse with having herniated discs and all these different things that take place. And so sciatica, which is, in my case, is the nerve damage that permeates down your legs and creates constant pain and issues. I have constant spasms. I'll have spasms and jerking randomly. At this point, I only have really 2 stages. There's really not a point, and I mean, I'm grateful to be able to walk, period, because there was a long time after I was having the seizures and I was having falls that I couldn't even walk. I was in a wheelchair. So I'm grateful for being able to walk at all at this point. But I only have 2 phases. I have a lot of stiffness. I have a lot of problems with being able to walk. And sometimes I'll make light of it saying, I walk like a toddler, which I do. I either walk like a toddler or I walk like an old person, because at times, if my back, I mentioned before, my back will just completely start to go over. And when it starts that, I know that I'm not going to be able to be walking around. I need to get somewhere and sit. Period, point blank, because it's getting ready to go out. So I guess unintentionally, this entire video was about my daughter's birth and how my back problems came about. And I was 26 years old when my daughter was born. So I've pretty much had that problem since then. And I am now 48 years old. And it just gradually gets worse and worse. So, being grateful, I am definitely grateful that I have any ability to walk. As I stated, I was in a wheelchair for a year and a half, I believe. Maybe a little less, maybe a little more, but you get a new respect for everything when you don't have mobility. You don't have the mobility you want. You don't have access to a lot of things when you don't have mobility. And so, yeah, that's how my back problems came about. And I don't take pain medication. I've taken pain medication in the past. It just really doesn't do much. I take ginger to help with the inflammation, because there's a lot of inflammatory issues when you have arthritis, and that helps prohibit movement properly and pain. So I will occasionally take Tylenol. I take several other things to attempt to help with muscle spasms, limit them, and to attempt to limit the nerve pain. I take ashwagandha, which is another herb, because I would rather take herbs than other stuff. And it does tend to help, but in the long and the short of it, there's not much you can do. Doctors at one point were talking about fusing bones in my back, but they don't want to do that because of everything being long term, and they consider you to be a younger person. I believe I was in my 30s when they mentioned that. But it's just really not an option. First of all, I didn't want to do it because I don't feel that anything is advanced enough for that to work properly, especially with your spine. And I've learned firsthand how much your spine plays a role in everything to do with your mobility and your body. And second, they don't want to do it because that's years of being possibly, if it doesn't work properly, being on disability, or if you can get disability, good luck with that. And different things like that. So doctors, they don't like signing off on that. They just don't like signing off on that when they consider how many years ahead that you have. I personally think it's bullshit. You should be helped no matter what age you are. If you want that, you should have the option of that. But to me, it was just like, you're telling me that you obviously have no guarantees. You don't feel comfortable with your own job, as far as I'm concerned, if you think that something is going to go wrong, and that's what you're basing it on, so you refuse to do it. That was my standpoint. But so that is the full information on the back problems. Well, mostly. This has been, jump into the end. Please like, share, subscribe, comment, hit the notification bell so that you can be one of the first people to receive notification when we post videos. We deeply appreciate you. We appreciate you being part of our community, and we appreciate any of those who are watching our videos and listening. We hope that something can be gained from other people being able to be aware of both DID and any other topics that we may be choosing to talk about. This has been Solara for the Notorious DID, and for today I say bye.